Hello everyone, my name is Kenneth Pereira and I'll be presenting a quality improvement project from Sinai Grace Hospital in Detroit, Michigan that focuses on improving aspirin administration following CABG surgery in a low resource and understaffed setting. So it's pretty well documented in the literature that early postoperative aspirin following CABG surgery improves both short-term and long-term venous graft patency. The question then becomes, how long after CABG surgery involving venous conduits should aspirin be given, and how late is too late? While research has demonstrated that initiating aspirin therapy within 24 hours provides the benefit of improved venous graft patency, the strongest evidence supports administering aspirin within 6 hours of CABG surgery, which has been adopted as the mainstay of treatment. Studies have shown that giving aspirin greater than 48 hours following surgery does not provide the benefit of venous graft patency. The goal of our quality improvement project was to increase the number of patients receiving aspirin within 6 hours of CABG surgery and incorporate this standard of care into our everyday practice. To accomplish this, we initiated a plan, do, study, act cycle that involved modifying our postoperative CABG checklist to include written and verbal orders for aspirin within 6 hours of surgery. Since our default order set called for aspirin within 24 hours, a separate written order was placed in addition to direct verbal instructions to the ICU nurse, clarifying that the aspirin should in fact be given within 6 hours. We then performed a retrospective chart review of the CABG surgeries performed at Sinai Grace Hospital 1 year before and 1 year after implementing our quality improvement project to determine how effective our intervention was. As you can see on the left, in 2020, before we initiated our quality improvement project, there were 39 CABGs performed at our hospital. Of those 39, 9 patients were given aspirin within 6 hours of CABG, which represents a utilization rate of 23.10%. Whereas on the right, in 2021, after we initiated our quality improvement project, there were 29 CABGs performed at our hospital. Of those 29, 22 patients were given aspirin within 6 hours of CABG, which represents a utilization rate of 75.80%. In total, this represents a 52.70% increase in the utilization rate of aspirin administered within 6 hours of CABG surgery from 2020 to 2021 at Sinai Grace Hospital. Locally, this is of particular importance given the strong presence of coronary artery disease risk factors within our community, such as high cholesterol, hypertension, diabetes, smoking, and obesity. There was some initial hesitancy toward early administration of postoperative aspirin in CABG patients over the concern for an increased risk of bleeding. However, studies have proven that administering aspirin within 6 hours does not increase postoperative bleeding or blood transfusion requirements while improving venous graft patency as previously discussed. We made a very intentional change to our daily practice to improve patient outcomes, which is supported by evidence-based guidelines, and as a result, more patients in Detroit are receiving proper post-op cardiac surgical care. Our plan is to further improve the utilization of aspirin in CABG patients through future repeated PDSA cycles, which we are well positioned to do going forward. In all, we were able to successfully increase the number of patients who received aspirin within 6 hours of CABG surgery using an updated postoperative checklist and clear communication with nursing staff team members despite the challenges of functioning within a low-resource and understaffed hospital. We hope that this project serves as an example for other institutions in lower socioeconomic settings facing similar barriers to care. Early administration of aspirin within 6 hours is the new standard of care for cardiac surgery patients at Sinai Grace Hospital in Detroit, Michigan. Lastly, I'd like to thank Zachary Brennan, Saurin Pauluri, Nathaniel Reed, Dr. Mendel, and the incredible nursing staff at Sinai Grace Hospital for making this project possible. Thank you.